Once somebody's called the Frontline Strong number, they've reached out, how are people matched with the right provider?
So the first thing is when you fill out that intake form, it's going to have questions on it about where you live, whether you're looking for in-person care or if you want telehealth, if you're looking for a particular type of therapy. Maybe you heard something on one of these podcasts that you think would be helpful for you, if you have a preference for gender of your therapist, all of those types of things. So we'll take a look at that, and then we'll look at our list of culturally competent available clinicians and try to see basically who hits as many of those bullet points as possible so that we match you with someone that has the highest likelihood of kind of fitting your needs.
What is the goal of that first appointment, and how does that first appointment or first two appointments kind of guide where the care goes from there?
Yeah. So the first couple of appointments really are all part of like the intake process, that initial evaluation. And the biggest goal there is really, number one, to build rapport. That is hands down the biggest predictor of a successful therapeutic relationship, is if you and your therapist have good rapport. It means that you have a good connection, you feel comfortable talking to them. And sometimes it doesn't happen on the first visit because depending on how reserved you are as a person, sometimes it takes me a couple of times with a person to kind of crack through their crusty outer shell. So that's the point of the first couple of sessions, and then also to kind of get the history of what's going on, what are your concerns, what brought you in. So it's really just having a conversation about all of those things.
So really, you're just in the data gathering mode for a while.
Yeah.
Versus like when I go see my doctor, it's a 20-minute onslaught of all the things. They gather the data, they take the blood, they do the stuff, and then results come in, you make a decision.
Yeah.
How you practice medicine in your world, it's a lot slower in the data collection process then.
Our division of medicine is a lot slower because we're reliant on what you tell us. We don't have magical scans. I can't take a blood test for most things to figure out
12% sad.
Yeah.
Yes.
We just don't have that science yet. So we do have to get it through that relationship. And so we have to spend time developing that relationship and kind of getting all of that data verbally.
One of the things on the peer support side that we hear a lot of is, after one or two, they're like, I don't think this clinician's for me. And they get discouraged. And they're like, well, this person didn't help. And sometimes they don't go back to see somebody else. Through the program, through Frontline Strong, if somebody doesn't have a good feeling, doesn't have a good rapport, personalities aren't matching, whatever it might be, is there the ability then to have them get another clinician within the program?
Yeah. I mean, in a way, it is kind of like dating and going on that first date. First of all, I do encourage people, usually the first time that I meet them, I kind of set out the lay of the land that don't expect to feel better after 2 visits with me. That's not how therapy works.
Right.
But if you feel like you're just not connecting with the person or you're just not clicking with the therapist, it is 100% okay to go back to the FST line and say, hey, can I get hooked up with somebody else? Like, this just isn't working for me, their style. I mean, you can't predict which 2 humans are going to be connected and are going to be able to build that rapport. So we are all professionals. That is part of our training. I would much rather you say, you know what, I really like Dr. Kate. She's really nice, but I just don't feel comfortable talking to her. I would much rather have you say that and go see one of my colleagues than me continue torturing you by making you come in and talk to me when you're not comfortable doing it. It's not going to hurt my feelings.
Right. And that's probably a part of your curriculum coming up. 100%. Learning is that you need to be detached in a way that you're available to the person, or you need to not be available to the person.
That's just professionalism.
Why do you think it's so important for people like yourself that could treat first responders and even their family members to really understand what a first responder goes through in general and balancing their life?
Well, I think part of it just goes to even being able to develop that rapport that we talked about. If you feel like you have to explain every little nuanced thing to me, that gets really annoying for you.
Right.
And so if there are things that I already understand because I understand your culture and where you're coming from, that just helps us kind of level up that rapport.
Well, if I only got an hour.
Right. It comes back to then it's not like you explain it to someone once and they understand it. Right. If you haven't experienced it, you don't really fully, truly understand it.
Yes.
So if I have that, then every time you tell me a story when you come in and because you had a bad run or something happened and you want to talk about it, you don't have to go through that all over again.